about hernia. In hernia, the first class is about general principles and treatment for hernia, and also we are going to see about umbilical hernia. Hernia. To define hernia, it is a protrusion of an organ or tissue through a normal or abnormal opening in the wall of that cavity, either to lie beneath the intact skin or to occupy another adjacent body cavity. Here I have listed some of the common terminologies used in hernia. True hernia. In this, the hernia is with hernial sac, and the hernial sac may be of peritoneum. False hernia. The hernial sac is absent in these type of hernias. Example, diaphragmatic hernia. Reducible hernia. If the content of the hernia is reducible and repositioned into that cavity is called as reducible hernia. If the contents are not repositioned into the cavity, it is called as irreducible hernia. Strangulated hernia, where there is arrest of blood supply due to strangulation of the organs in the hernial content, is called as strangulated hernia. Incarcerated hernia, in which volume of the content is increased and it is not irreducible, is called as incarcerated hernia. Parts of hernia. The hernia is of three parts: hernial ring, hernial sac, and hernial contents. Now we shall move on to the general principles and treatment of hernia. First, reduction and retention by bandage. Abdominal bandage or elastoplast bandage are useful for retention of the hernial contents to protrude again. The bandages are retained for 2 to 3 weeks. The application of bandage is best for umbilical hernia, especially in young calves and puppies. The next is application of blisters or injection of irritant solutions close to the hernial ring after reducing the hernial contents. It causes inflammation, swelling, which prevents recurrence. Next is ligation or application of hernial clamp. A set of through matter sutures may be applied at the base of the hernial sac, or application of hernial clamp after reducing the hernial content to facilitate sloughing of sac and simultaneous closure of hernial ring. Next, radical operation for hernia. The hernial area should be prepared aseptically and the skin is incised with an elliptical skin incision, and the hernial sac is incised after skin incision, and the hernial contents are returned through the hernial ring. Again, the hernial ring is ligated at its neck, amputated with the excess sac, and the stump is pushed through the hernial ring and repositioned into the cavity. After the stump is introduced into the cavity, the borders of the hernial ring are freshened and sutured together with the closure pattern of overlapping suture pattern. It is otherwise called as vest over pant pattern. The suturing of the hernial ring is called herniorrhaphy. If the hernial ring is very large, suturing the edges is not possible. In such a cases, the gap is covered with natural or synthetic materials and sutured. This technique is called hernioplasty. When the hernial ring is too small to push the large volume of hernial content, the edges of the hernial ring are extended by using scissors or scalpel. Extending the hernial ring is called as chelotomy. Now we will move on to the treatment of umbilical hernia. Umbilical hernia occurs commonly in calves as congenital one or acquired one. The acquired hernias are common due to the weakness of the muscle resulted from the abscess. Umbilical hernia is also common in young puppies. For young puppies, the conservative methods are suitable, and for that belly bandages or clamps are applied for small sized reducible hernias. It allows the hernial ring to close by cicatricial contraction. Sometimes a coin may be placed over the hernial ring and bandaged. In young puppies, it is not advisable to do the surgery or to perform the surgery before 3 months. Automatically, the hernial ring closes in case of congenital hernias by 6 months of age. If it is persist, the umbilical clamps or clamps are applied on the hernial sac after reducing the hernial content. This causes the sac to slough off and healing takes place after sloughing. Application of clamps causes necrosis and sloughing of the hernial sac within 10 to 12 days. The skin wound heals by second intention healing. Injection or application of irritants like hydrochloric or sulfuric acid around the hernial ring is also done to stimulate tissue formation. Radical surgery for umbilical hernia. The animal should be fasted for 24 hours and it should be restrained under dorsal recumbency either by sedation or anesthesia. The umbilical site should be prepared aseptically. An adequate elliptical skin incision should be performed under local anesthesia. The skin adhesions with the hernial sac has to be removed and undermined carefully. The sac is freed from the hernial ring and repositioned into the abdominal cavity. The irregular ring edges should be converted into an elliptical shape for smooth closure by incising the ring caudally and cranially with V-shaped incision. The ring should be closed by placing series of overlapping sutures through its edges using heavy non-absorbable suture material, especially silk. After all sutures have been inserted, the ends of the sutures are pulled, tightened and secured starting from the center towards the edge of the commissure. The exposure edges or the exposed edge of the ring should be closed or anchored with the abdominal wall using a continuous suture pattern with absorbable suture material. The skin flaps should be opposed by matter sutures or simple interrupter sutures using non-absorbable suture material. Postoperative management for umbilical hernia. The animal movement should be controlled and controlled exercise should be given to the animal. And the diet should not be bulky one. Less bulky diet should be given for a week. Antibiotics should be administered if necessary. The suture should be removed on the 10th or 12th postoperative day. It is often suggested that small umbilical hernias in female puppy or kitten can be corrected at the time of ovary hysterectomy. In case of umbilical hernia, the defect is so large, the opposition of the linea alba is not possible. A Teflon, Dacron, stainless steel mesh or any synthetic mesh material or a flaps of peritoneum and rectus abdominis muscle may be used to reconstruct the defect. These pictures shows you the surgical procedures for umbilical hernia. First picture is the preparation of surgical site around the umbilical hernial area. The area should be clipped and shaved thoroughly and antiseptic has to be applied. After application of antiseptic, take a sterile needle and local anesthesia has to be employed. The elliptical skin incision has to be made and the surgical excision of the hernial sac has to be performed. After repositioning the hernial content, the hernial ring should be excised or refreshened by excising the borders of the hernial ring. Then the hernial ring has to be closed with the Westover band pattern, that is overlapping suture pattern. After closing the hernial ring, complete the herniorrhaphy by skin sutures.